Hello guys, this is Brian here with a quick update. Today is February the 20th, 2015. And but let me tell you, I had a hell of a day yesterday. I ended up in the emergency room yesterday in severe pain. So let me tell you what happened. Yesterday was the 19th, and all day I called in sick because I just didn't feel so good. Um, just extremely tired. Like I ran 100 miles. That exhausted, tired, and very nauseous, not want to eat nothing. And I woke up around 8 o'clock in the morning and wasn't very hungry. And I went back to bed. And 11 o'clock, I woke back up. And still wasn't very hungry, real nauseous, but my stomach was gurgling. Um, you ever had the feeling that you're nauseous, but your stomach is gurgling because it wants something in it? So I was going in through the kitchen looking for some plain saltine crackers. I wanted a cracker. I wanted to eat a cracker or two to settle my stomach down. And we didn't have anything plain. All we have, all the stuff we have here, flavored garlic or onion crackers and butter, and none of it really sounded appealing to me, and don't think that was going to be helpful on my stomach. Um, and I remember the night before we had some chicken rice. Well, I cut some chicken up and took 3 bites of it. I wasn't very hungry. And 3 bites of rice. Just nothing like a meal or anything like that. And kind of picked at it for 30 minutes. And this was 11 o'clock in the morning. And just do the rest of it. So literally I took 4 bites of it mainly. Little bits of chicken and rice. So it really adds up to full spoonfuls of food. Because I was hungry. Kind of nauseous. But needed something in my stomach for it to stop gurgling and growl. And then I kind of relaxed in the recliner, watched some TV, and around 1 o'clock in the afternoon, 1 o'clock and 1:30, all of a sudden I had the most horrendous stomach and chest pain I ever had in my life. And then it hit me immediately like that. It didn't come on, it just didn't come on softly. It hit on big time. And all of a sudden, I was just drenching with sweat and just sweating profusely all over the place. My shirt was drenched almost. And in like 5 minutes of this, all the going on, I said, I gotta go I told my family member, you have to take me to the emergency room with something. Something's seriously wrong with me here. And I was bent over and walk up straight and hurting really bad. And she said, I think you may have I think you may have having a heart attack. I said, well, that could be. It felt like my stomach was being ruptured almost. It felt like a severe gallbladder attack, even though my gallbladder had been removed 10 plus years ago. So I knew what a gallbladder attack felt like. It kind of felt like that, but 10 times worse. The worst feeling I have ever had in my life, literally. And it was not in the center of the chest. It was more towards where the chest and the stomach meet, in that area, underneath the chest, basically, but in the middle. It's kind of hard to explain. But it felt like a gallbladder attack, but 10 times worse. And I also had the feeling my stomach was fixing to rip open or something. Well, just severe pain and just sweating. So now, we would have called 911, but let me tell you about that here. The emergency room is literally 2 to 3 minutes away in the car, down the street, less than 2 miles. Now, if we were to call 911, the ambulance would have to come 5 miles from the other direction, come over here, take a while to get me loaded up. They don't do that. They try and get you on the stretcher and roll you up to the street. It just takes an awful long time. And plus, insurance companies do not pay very well on ambulance bills because most of them are out of network. Well, I know for sure these people are out of network Blue Cross already from experiences in the past. And plus, they're crappy. They're not worth a damn. And plus, I don't want to spend $2,000 going down 2 miles down the street, where I could, my family member could got me, did it myself, got me in the car. So I got my shoes on and ripple wobbled and kind of wibble wobbling outside to the car, got me in the car and took off 100 miles an hour down the street to the stop sign and then hold fast down another stop sign and get on the 2-lane highway, went 75 miles an hour, middle of the day, and got there in a hurry. And she went in and told them, I really couldn't get, I can't, I literally did not have enough strength to get myself out. I opened the car door and stuck my right leg out, and I couldn't get enough strength to get me out of the car. So they ran out with the wheelchair. They got me in the wheelchair. They ran me into the room. And of course, they asked me what was going on. I said, well, it feels like a gallbladder attack, but I don't have a gallbladder, so I don't know if I'm having a heart attack or what the case may be. So they pushed my shirt up, and immediately they did an EKG, and the EKG looked okay. So they went ahead and started IV, and it took them 3 times to get me an IV right because my hand's it's swollen. I don't know if you could tell, but his hand is swollen. Took them 3 times trying to get an IV. And I said, I need something for pain now. And I was just thrashing around and breathing real hard. I couldn't breathe right, huffing and puffing. And they try and get my breathing down. They gave me some oxygen. They said, if you don't calm your breathing down, you will have to ventilate. You may pass out from that. My blood pressure was a little bit high, they said, but nothing extreme. But they asked them, well, can't you shoot me with some pain medicine in my hip or butt? She said, normally we would, but you're in severe pain now. We want, if you do it in the hip or butt, it will take a long time for the pain medicine to get into your system and circulate. Once we get your IV, that goes directly into your vein, and you get hit with pain medicine like that, within a minute or two. And that's true. I had some pain medicine shot in my butt, and it took a long time to circulate because it sits in muscle for a long time, and then it starts circulating. They hit me with some morphine, fentanyl. They gave me something for my nausea. I think it was Phenergan. Zofran or Phenergan. I think it was Phenergan because I think Zofran is the one that doesn't really make you goofy. But when they gave me the Phenergan one, because they gave me the morphine and fentanyl first, and I felt that a little bit, and the room starting to tilt a little bit. But as soon as they hit me with that Phenergan, that room started to spin. They gave me some big doses of medicine. And then they came 3 minutes later. They came back. They had trouble getting out of the drug cabinet, and they gave me a big shot of Ativan to calm myself down. She said the room might spin with this, but this will relax you and make you kind of sleepy. Morphine. I had morphine before. It doesn't really make me sleepy. Now, after hours after having it, it makes me sleepy. But she said, this will make you sleepy now. So that in the room, spinned around a little tiny bit. But I was still breathing real hard. Was in severe pain still. They took my labs. And they had an EKG. EKG only took 3 seconds to do because they put the little electricals on your chest, and that looked pretty good. However, you can still have a good EKG, and you can still even pass a stress test, and you still can have a heart attack. That's exactly what happened to my grandfather. He had an EKG that looked okay at the doctor's office, and he had a stress test and looked okay, and had a heart attack 30 minutes later. Because they thought he had a heart attack that morning too, so they did all that. Not the doctor's office. I mean, at the emergency room. They did the EKG at the emergency room, and then the treadmill stress test thing at the emergency room. Passed all that. So those indications alone doesn't mean you're out you're out of the woods. However, she said since my pain was a little bit lower than the chest level, okay, I was kind of pointing to my chest. Because she can't felt on my stomach, and where she felt it was more tender. She said, I don't think you have a heart attack. I think it has to do something with your stomach. She said, do you have a history of gallstones and all this? I said, yes, but however, I had my gallbladder taken out 10 years ago. She said, people who have the gallbladder taken out still can have gallbladder attacks because sometimes what happens is a stone might fall into the bile duct after, when they do the surgery. She says, so we want to do a x-ray and a CT scan to make sure, but since you had a gastric bypass, we're thinking you may have a piece of food that's stuck. So they did an x-ray of my stomach and all that mess, and that turned out to be okay, thank God. She said, well, let's go ahead and still do the CT scan, but this is going to take a while because they gave me two 16-ounce things to drink. It wasn't really bad. It was some tropical flavor, clear liquid. In the old days, if you remember, it was a nasty chalk barium crap. Oh my God, it was god-awful. Ugh. But this wasn't really bad, but I wouldn't drink it. You gave it to me outside the hospital. I wouldn't drink it or anything like that. So it took 2 hours to drink that because total together was 28 ounces. Of course, have a gastric bypass. You can't drink all that real fast, obviously. So it took 2 hours. Then I had to wait 1 hour after I drink it for them to do the CT scan to make sure it gets into all the organs and into the system and all that. So the CT scan looked good, but by the time I drink all that, my pain almost went away. But I still had some pain. But I don't know if it was the combination of all the drugs they gave me finally helped it, or all that stuff I was drinking. So if it was something stuck, all that liquid made it go down. That was my theory. And they checked the CT scan, no stones. In the X-ray shows no stones in the bile duct. And the only thing they could think of, either something was stuck, like a piece of chicken or something, but I'd say it was real little. Or, in rice, I only have 4 spoonfuls of rice. I mean, it's not like I had a big old meal of it or anything like that. She said either it was something that got stuck, or you actually might have an ulcer, stomach ulcer. I said, well, that does make sense because gastric bypass patients are prone to having ulcers. Because I told her months prior, with my shoulder, they gave me Celebrex to take. And I told her I took all these other stuff to prevent ulcers. But I told her I didn't take the Celebrex every single day. And she said, one pill can do it. One pill can cause an ulcer. So they think I might have a stomach ulcer. And she said, I got to call my GI doctor because the only way they could see an ulcer, 99.9% of the time, a CT scan will not pick up an ulcer. Which I don't understand that. I thought it would. Maybe an MRI would. Maybe an MRI has to. I don't know. But they would have to do a scope, upper GI scope to detect an ulcer. So they said, look out for if I vomit any blood. That's a big red flag. If I have a fever, if I pass blood going to the bathroom, number 2. Bloody stools, look for that. Dark stools, that's indicating that's a bleeding ulcer. That when they go back to emergency room. So I called the GI doctor today because today's Friday, but he's out of town for the whole entire week. So Monday I'm gonna call his nurse because the nurse from the hospital called me today and said, they call you to follow up to make sure you're okay. And she rather know. She said, we want you to see your GI doctor ASAP. And told her where the doctor's out of town, and she said, call them back and tell them that you can see any doctor or the PA. And of course she called at 4:30 from the hospital today. Of course, doctor's office closed up at 4:30, so I'm gonna call them Monday and speak to the nurse and tell her I need to get in. I need to get in soon. It don't matter if I could see any other doctor in the practice. I don't care. So they think I have a stomach ulcer. The doctor at the hospital told me at the emergency room, she said, if you have that pain again, come back because you really not going to get anything control. But she did give me a bottle of Vicodin. Also Tylenol 3. She said because the new law with Vicodin all that stuff with coding took an effect. It's harder to get back in since October. So she just gave me both, and just in case. She also gave me some prescription for heartburn medicine, which I already have, so that I didn't pick that up. And also Carafate, liquid Carafate. She said she wants me to take it 5 times a day instead of the regular 4, and see if that helps. So I went and picked that up. And I take that for a while and see if that helps. Today I felt pretty good. Didn't much stomach pain. Kind of bloated though. Kind of like a fullness feeling. Drinking all fluids today. Yesterday I didn't drink any, except that nasty stuff that they gave me in the hospital. But other than that, I'm doing okay today. I feel a lot better. I have a little headache, and of course that's from all the drugs, like a hangover, all those drugs they gave you. But other than that, I feel okay. So we shall see what the GI doctor has to say about all this. And of course, I could call my gastric bypass doctor, but he can't do nothing because he's not a GI doctor. He does not do the scope. A GI doctor has to do the scope. So, and no sense going to the primary care doctor because he can't do nothing. She said you have to go to a specialist. You might as well just start out with a specialist, and the specialist you got to see is your GI doctor because they're the only ones who can go and see the scope and see your stomach. She said in the CT scan, my stomach looks pretty good, my pouch, so there's no rupture there. Everything's intact. If there was a rupture, I would be hemorrhaging blood into my system, and so that's okay. But I ate some soup today with some chicken noodles. I mainly ate the chicken and did okay. Didn't want to eat nothing really solid yet because I really don't want that pain again. So maybe it was a stomach ulcer. Maybe it is a stomach ulcer. I really hope not. I hope it was just maybe something was stuck because I don't want to go through the whole process and getting a stomach ulcer repaired and fixed and treated. That takes a long time too. So hopefully it was just an isolated instead of something getting stuck. But I ate bigger, the chicken pieces were extremely little. So maybe they got all stuck together and that caused that problem. I don't know. So if you have any questions or comments, please post them below. Love to hear from you. Talk to you later.